Joining me now, Director of Columbia University's National Center for Disaster Preparedness, Dr. Erwin Redlener. Dr. Redlener, thank you very much for joining us. I want to start, we've got a lot to talk about, but I want to start with this containment zone in New Rochelle. What exactly does that mean?
Well, it's an effort to define a specific geographic area around that particular synagogue, which is sort of the initial point of contact. However, you know, the guy who first tested positive was commuting back and forth to New York City on busy commuter trains. He went to Grand Central Station, walked to his office, etc. And the other issue is that the 1 mile zone is fairly arbitrary because they're not closing all the schools in New Rochelle. There's families that have kids.
So what's the point?
You know, the point is to try to do something to contain the spread of the virus, but it's already the beginnings, the early signs of a wildfire of spread is what we're dealing with.
So you're saying even though they're trying to do something, this is just too small scale?
We're going to find out in the next couple of days whether it's going to be enough or not. And the main thing is, you know, in the background, what we have in the United States right now are what I've been calling random acts of response, because what Seattle is doing is different from what Orlando is doing, from New York City, et cetera, et cetera. And I think this harkens back to two big issues that the federal government needs to either acknowledge or deal with. And the first is this unconscionable lack of the ability to test lots of people that should have been solved many, many weeks ago. And now we're behind the 8 ball because we're making really important decisions on consequential public health moves that are going to be dramatic, is number one. The second thing is it's time for the CDC to stop pussyfooting around here and come up with very specific directions, not suggestions, so that the entire country's on the same page here.
The president says no one saw this coming, but experts have been warning of this for years. There was an Ebola crisis a few years ago that was threatening to spread around the world, including to here. There have been other epidemics out there, SARS, swine flu. I mean, this has happened before.
Yeah.
Why is there not a government response in place? Why has there not been a plan to combat this?
Yeah, so there's going to have to be a serious postmortem on what happened, what went wrong. It's too probably early to do that right now, but I think what can be done right now is for the federal government to issue a very consistent policy that applies across the United States. These kinds of things will work, these won't work. We can't just have people experimenting locally with somebody doing a containment zone, somebody shutting schools, other authorities not shutting schools. This is too chaotic, and I'm actually very concerned about that.
So the description of what's happening in Italy at hospitals is dire, very scary. The doctors are getting sick. They're running out of health workers. Everything has been moved to treating those affected. There is concern that people that come in with a trauma or people that come in with a different issue that's not coronavirus related, that they are not getting treated. There's worry that they're just watching people die and all they can give them is oxygen. I sent these reports to somebody I know that works in a hospital with an infected person in this country, and I said, is this what's going to happen here? Are you concerned about this, or is this just too alarmist? And the person told me, no, it's not happening here yet, but from the emails that the administration of his hospital are putting out, they are prepared for it, and they're worried that that is going to start happening here.
Well, they should be. We're about 10 to 15 days behind Italy in terms of what will happen to the healthcare system.
That's it, just 10 to 15 days.
10 to 15 days. So actions need to be taken now. You know, for a long time I've been talking about this and saying we have to find that middle ground between complacency and panicking people. And
what is the middle ground?
Well, the middle ground is being properly prepared, is getting the tests out there that are effective. You know, we're supposed to be able to do tests locally, local hospitals and health departments. We have the permission, we have the equipment, but it's still
Why don't we have drive-through testing like they have in Germany?
That's a rhetorical question.
I mean, just serious. I mean, why are people walking into hospitals and interacting with a number of different people before they are tested? In Germany, you drive up to a window, you get tested by somebody in a hazmat suit, basically, and then you move on your way.
In South Korea, that's happening also. Or we could have mobile units with testing equipment to go to places and have people come on. But we don't want people just overwhelming the emergency rooms because it's going to paralyze the whole healthcare system.
Why is our system not as together as a system like Germany or a system like South Korea?
The vast majority of our hospitals, for example, are private voluntary hospitals that basically do their own thing. And they're going to need to have a much more directive understanding of what needs to be done. Because
healthcare is not nationalized in this country.
Yeah, healthcare is not nationalized, and I'm not even saying it should be, although I think it should be. But I do think what we need is real direction that's very specific and concrete that everybody's got to follow. And if we have to declare a national emergency at a higher level to do that, I think it's time.
Dr. Irwin Redlener, please come back and talk to us more about this, because it is very difficult to figure out how alarmed you should be, how prepared you should be, because we are getting mixed messaging from the government, from local resources. It's just very hard to figure it out right now. So we appreciate you coming in.
Sure.
Thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.